Hi Keith, can you hear me okay?
Yes, Colin can hear you, Grant. So that's us on now, Colin, with four members present, so we're good to go.
Okay, and we are on public session as we speak, are we?
We are, and officials are ready.
Okay, good afternoon, members, and we have a quorum and I call the meeting to order. I'd like to welcome all members who are participating by video conferencing. And I would remind members about the protocols regarding the use of electronic devices. Do we have any apologies, Keith, in for today's meeting?
No, I haven't received any, Chair.
Thank you. And any members aware of any apologies? No. Okay, thank you, members. So, members, then there are three SRs on our agenda today. These were deferred from the meeting on the 24th of February. The first two are SRs relating to travel restrictions. Departmental officials are here today to brief the committee on the provisions of the regulations. I refer members to the clerk's memo at tab 2.1 of the pack and to the SR papers at tabs 2 to 3. 2.3. I'd like to welcome now Mrs. Carol Picton-Linus, who is head of COVID-19 international travel regulations. Can you hear us okay, Carol?
Hello, Chair. Yes, I can. Good afternoon.
Thank you. So I'm here. Yes, I'm seeing you now as well, Carol. I'm hearing you. Thank you. And Carol Doherty, who is deputy head of COVID-19 international travel regs. Can you hear us okay, Carol?
Yes, I can. Thank you.
Yeah, so two Carols, but I'm sure we'll manage that just fine. Is Carol the correct way to pronounce yours, Carol Doherty, or is that a different pronunciation?
Yes,
Carol,
that's
yeah.
correct, Chair. Thank you.
Okay, listen, thank you both very much. Welcome to this afternoon's committee, and we appreciate your attendance. And would you go ahead and brief members, and then we'll go to some questions. Thank you.
Okay, Chair, thank you so much. I'll be doing the briefing today. Carol, with an E, will be providing any supplementary support if necessary. So thank you very much for the invitation to attend today's meeting at the committee. Committee is considering two statutory rules today, which have been made as a consequence of the strategic review of the United Kingdom International Travel Regulations January review of border measures. The policy underpinning these regulations aligns with the UK government in relation to the further relaxation of border health measures following decisions taken at a Cabinet Office COVID-19 committee meeting on the 24th of January 2022. UK government and DA ministers attended the meeting and agreed to align with the recommendations in the papers presented for consideration. So if I may make an overarching summary of the two sets of regulations the committee wish to consider today, they are SR 2022 number 43 and SR 2022 number 46. If the committee is content, I will briefly summarise each set of regulations in the order in which they were made. So the first set of regulations are SR 2022 number 43. They are the Health Protection, Coronavirus International Travel, Operator Liability and Information to Passengers, Amendment number 2 regulations, Northern Ireland. And these regulations came into operation on the 11th of February. These regulations made changes to the Health Protection Coronavirus International Travel Regulations NI 2021 and the Health Protection Coronavirus International Travel Operator Liability and Information to Passenger Regulations Northern Ireland 2021. The objective of the UK International Travel Regulations January review of border measures was to agree a more stable and sustainable system for 2022, which returned to restriction-free travel as soon as it was safe to do so, but with clear contingency measures in place to return to pre-COVID levels of international travel and to revitalise the industry, tourism and global relations. So primarily these regulations were made to extend the time for passengers to complete their passenger locator form from 2 days to 3 days. The window for PLF completion had previously been 48 hours to prevent incorrect forms being submitted should policy change at short notice. But to make it easier for travellers and given the increased stability in policy, this is extended to 3 days. The regulations also amend the information to be included on the passenger locator form, and the aim is to shorten the passenger locator form to confirm a traveller's basic details, travel history and vaccination status. Following the changes to health measures at the January review, including the removal of self-isolation and testing for eligible fully vaccinated passengers, several data fields in the PLF will become obsolete and are removed. The regulations also remove the requirement for a fully vaccinated person, an eligible non-red list arrival, to book and undertake tests upon arrival in Northern Ireland. So this means that fully vaccinated arrivals only need to complete a PLF. Evidence suggests that the economic benefits of testing outweigh the marginal additional surveillance that an LFD system adds to our regime and removes all tests for eligible vaccinated travellers. The regulations also relax the requirement for an unvaccinated person, that is a non-eligible non-red list arrival, to book and undertake tests upon arrival in Northern Ireland, so that non-eligible non-red list arrivals will be required to complete a passenger locator form undertake pre-departure testing, which can either be an LFD test or a PCR, within 2 days of departure, book and pay for a day 2 PCR post-arrival test, which must be taken on or before day 2 following arrival. There will be no requirement to purchase a day 8 PCR test. However, should the day 2 PCR test yield a positive result, the associated self-isolation requirements should align with the current domestic guidance for self-isolation. I should mention that the non-eligible non-red list arrival commits a book and test offence if they fail to book and undertake a day 2 test without reasonable excuse. And a book and test offence is described in Regulation 23(1)(c) of the Principal Regulations. The regulations also remove the requirement for an unvaccinated person to self-isolate upon arrival. The much stricter regime for unvaccinated arrivals now also seems disproportionate, given the lack of evidence of a difference between vaccination status in terms of community transmission of Omicron within the UK, especially in light of the reduction of the self-isolation period to 5 days. Regulations also relax the requirements for those arrivals into Northern Ireland for work purposes who are exempt from the general testing rules for unvaccinated arrivals and who are required to undertake workforce testing. The new policy is that an LFD test must only be taken on day 2 now instead of days 2, 5 and 8. And this is because we want to, these are being updated alongside general traveller testing to ensure that they are not more onerous. Regulations also update the list of countries whose vaccinations are recognised and the way in which those vaccinations are treated. Chair, I can cite all those countries if you like, or you have the information in front of you. Content?
Members have the information. I think we're okay not to go through the list.
Thank you very much. Okay, the regulations also amend the operator liability and information to passenger regulations, and these replace a complex set of operator offences which can result in a very high total liability for an operator, with streamlined penalties that regulators could issue on the condition that high compliance is maintained, and Border Force and Department for Transport will work on a process if this compliance falls. Regulations also introduce a new requirement upon operators of transport services to implement and maintain systems to ensure that passengers comply with the various travel rules. This means that an operator must implement and maintain adequate processes and systems to ensure that passengers arriving in Northern Ireland on relevant services operated by the operator are in possession of a completed passenger locator form if they are passengers required to comply with Regulation 4 of the Principal Regulations. They are in possession of evidence that they are a person described in Schedule 4, i.e. exempt to certain rules in the international travel regulations, and if they claim to be such a person in their PLF. They also cover the requirement that they are in a possession of a required notification if they are passengers required to comply with Regulation 6, which is a pre-departure testing, and also in possession of eligibility evidence if they have indicated on their passenger locator form that they meet the COVID-19 vaccination eligibility criteria, and also to ensure that the passengers only arrive at designated ports if they are red list arrivals. The regulations also include a fixed penalty notice procedure for offences under the operator liability regulations. They also simplify the requirement for operators to provide information to passengers travelling to Northern Ireland, so that there are less different types of information to be provided at different times, and there is greater uniformity between the different ways that information may be provided. Regulations also require operators to keep records of how they have complied with their obligations to provide information to passengers under Regulation 10 of the Principal Regulations. And finally, they include a transitional provision which allows arrivals to be released from isolation early if their country of origin is now regarded as being safe in terms of vaccinations. So they allow a person to cease isolation at the coming into force of these regulations, of the regulation on board in new countries, provided they have arrived from a newly onboarded country in the 10 days prior to the amending regulations coming into operation and are consequently isolating, and they would have met the definition of a fully vaccinated traveller as defined by the regulations had their country already been onboarded at the time of their arrival. And the regulations also correct minor typographical and cross-referencing errors in previous regulations. Moving on to Regulations SR 2022 number 46, the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers, Amendment number 3 regulations. These regulations came into operation on the 13th of February. These regulations amend the Health Protection Coronavirus International Travel Regulations 2021 and the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers regulations. And these changes in the rule are a continuance of the decisions made at the UK International Travel Regulations January review of border measures. And these regulations were made to align with the United Kingdom Government and the DA's simplification and reduction model for exempting arrivals in Northern Ireland from the various coronavirus travel rules. By doing so, several exemptions that were listed in the Principal Regulations are reduced and, where appropriate, merged under overarching categories or newly named categories, for example, seasonal and temporary horticultural and food processing workers, which includes existing exemptions for seasonal agricultural workers, seasonal poultry workers, and a new exemption for pork butchers. The removal of the requirement to self-isolate for unvaccinated arrivals meant that those exemptions that relied solely on the self-isolation exemption could automatically be removed, thereby reducing numbers. The categories of exemptions falling under the workplace testing regime has been amended to reflect the new naming convention for the exemption categories. And the regulations correct an error made in an early commencement provision. Regulation 4 of Statutory Rule number 43 extended the time a person had to complete a passenger locator form from 2 days to 3 days after arrival in Northern Ireland. And that provision was erroneously brought into operation on the 11th of February, when it should have been brought into force on the 28th of February. And consequently, Regulation 4 of the Health Protection Coronavirus International Travel Operator Liability and Information to Passengers Amendment number 2 Regulations number 43 is revoked. And finally, these regulations make minor updates, including correcting typographical or cross-referencing errors, as well as updating web links. Chair, I hope that's been helpful to members. I'm happy to take any questions that members may have.
Okay, thank you, Carol. A couple from myself first, and then I'll take indications from members there as well. So, in relation to the criteria that are used to draw up these regulations, I take it that when you're looking at countries that are coming here, you're looking at levels of positive testing. And do you also look at testing regimes in any of those countries in terms of how robust they may or may not be?
Yes. So UXA has updated its risk assessment and methodology, and it continues to monitor threats. And they also look at the epidemiological data and the testing validity and the confidence they have in the data that they're getting from these countries. And what they do, they provide summary reports for UK government and the DAs on a fortnightly basis, or faster if any particular concerns come to light. So to answer your question, Chair, yes, we do. We take all those factors into consideration when we're looking at relaxation of any border measures.
Okay, thank you. And then leading on from that question, then what is the impact of the English government, the Westminster government, deciding that they are going to end testing altogether? Would you expect, now I know that decision hasn't been taken here, and I welcome the fact it hasn't, would you expect that to have a significant impact on where Britain are potentially going to sit on other countries' lists, red or otherwise?
Well, obviously that's not my sort of policy area. You're sort of asking me if Northern Ireland moves away from post-arrival testing, how.
Yeah, yes, that's the follow. I'm happy for you to go on to the follow-up. The follow-up is then what would happen were we in that scenario? Could we see a situation where we are persona non grata as a result of not having the things that we're looking for in others, that we don't have them in place here?
Yeah. So obviously, in terms of travellers arriving into Northern Ireland and the UK, we have agreed what our testing requirements currently are. As for people travelling outbound from the UK into other departments, into other countries, their testing requirements will, for example, may require them to have pre-departure testing, and that's for travellers travelling from the UK to organise that through private providers heading outbound. So that has no implications for these travel regulations, Chair, in the sense of people coming into the UK.
Okay. And the other one that so the regs that you're currently coming to with us and have been coming with a while are made under the Coronavirus Act extension of powers to act for the protection of NI order. Mm-hmm. That's due to expire on the 24th of March. Mm-hmm. If there was to be a situation arose on the 25th of March where a variant emerged in a country, what would the position be in terms of your ability to make the type of regulations that we have been discussing on a regular basis?
Okay. Well, Chair, as you quite rightly pointed out, there is the Coronavirus Act put in temporary powers in the Public Health Act to enable us to make emergency regulations in relation to coronavirus. And as you quite rightly say, those provisions expire on the 24th of March. There is scope within the Coronavirus Act itself for Minister here to make an extensions order, which must be approved by the Assembly here, which will extend the primary powers to make travel regulations for a further 6 months. So in effect, if that order is approved by the Assembly, if a variant of concern happened in the next few weeks where we needed to ramp up border health measures, then those powers would be in place for us to continue to make travel regulations.
And the Minister has previously indicated that he is bringing forward that extension. Can you update us on where that's at the present time?
Yes, well, I understand that Ministry is minded to do that and looking to agree a date for debate in the Assembly. So that's likely to happen in the coming days.
Okay, and I think that's particularly important, and I just wanted to put on the record, I think that's particularly important in the context of the fact that we're heading into an election, and many people are thinking that we could have a period of time before an executive is formed. So I think that's particularly relevant that we ensure that we future-proof in that sense to the greatest degree possible, and necessary and proportionate, of course, as well. But we need to be able to, and coronavirus, we have all seen on previous occasions, can be a very fast-moving dynamic in terms of the impact of variants or levels of spread. So thank you. That's all from me, Carol. I'm just checking there. I don't see any hands raised on screen. I'll check with the clerk. Does he have any indications from members, or members maybe content enough with that?
No, Chair, I don't have any indications from members.
Okay, so listen, we would appreciate, Carol, an update on the situation regarding that extension of the powers, and appreciate you coming today to the committee, and both of you for coming to committee, presenting on the regs, and for taking members' questions. Thank you both, and we can continue on with our formal consideration.
Thank you, Chair. Bye-bye.
All the best. Good luck. Take care. Okay, members. So we'll now, as usual, consider each of those formally in turn. The SRs are both subject to the negative resolution procedure, and the examiner of statutory rules has highlighted that rules 43 and 46 have breached the 21-day rule, but she is content with the explanation provided for that. So moving on to the first one is SR 2022/43. Have members any further issues they wish to raise in connection with this statutory rule? No members, thank you. No further issues to raise. So therefore, can I ask members to agree formally that the Committee for Health has 2022/43, the health protection, coronavirus, international travel, operator liability and information to passengers amendment number 2, regulations NA 2022, and has no objection to the rule. Are we agreed? Agreed. Thank you, members. Moving on to SR 2022/46. The second one that Carol briefed us on is have members any further issues they wish to raise in connection with this rule? No, thank you, members. I'll ask members then to agree formally that the Committee for Health has considered SR 2022/46, the health protection, coronavirus, international travel, operator liability and information to passengers, amendment number 3, regulations NA 2022, and has no objection to the rule. Are we agreed? Yeah, thank you. So members, then moving on to the next item is SR 2022/47, and this is an SR in relation to face coverings. Department officials are here to brief the committee on the provisions of the regulations. I refer members to the clerk's memo at tab 4.1 of the pack, and to the SR papers at tabs 4.2 to 4.3. So I'd now like to welcome again back to committee here today Mr. Niall Donnelly from the Health Protection Legislation Branch within the Department of Health. Hi Niall, can you hear us okay?
Yes, Chair, can you hear me?
Yeah, hearing and seeing you fine, Niall, thank you. And Siobhan Kelly, who's also within the Health Protection Branch in the Department of Health. Can you hear us okay, Siobhan?
Yes, I can indeed.
Okay, thank you. So I'll go back then just as first listed. Niall, are you going to lead on the briefing, or is that Siobhan? And whichever of you go ahead, please.
Yes, Chair, I'll lead on the briefing if that's okay, and then we're happy to take any questions afterwards.
Thank you.
So today we're briefing on SR 22 number 47. That is the health protection, coronavirus restrictions and wearing of face coverings revocation regulations, Northern Ireland 2022. This is a short regulation that revokes both the remaining coronavirus restriction regulations and the wearing of face covering regulations. It was made on the 15th of February this year and came into operation at 5 p.m. on the same day. Excuse me. It had been the intention of the executive to review these regulations at its meeting on the 10th of February that was scheduled. Work had been done to assess the options and their impact at that stage. However, in the event, that executive meeting did not take place as the executive was dissolved. Minister Swan concluded that in light of the position in respect of the virus, the pressures upon the health service, and the executive's commitment not to have regulations in place any longer than strictly necessary, there was a case for ending the remaining legal restrictions. His conclusion included the determination that the measures that the regulations had contained should still, however, compromise official guidance to the public and organisations. I think it's worth noting what these measures are that remain in place. So first of all, that anyone organising gatherings over a certain size, 15 indoors or 30 outdoors, should still conduct a risk assessment and take all reasonable measures to limit the risk of transmission. Those responsible for hospitality and entertainment venues should still conduct a risk assessment, take all reasonable measures to limit the risk of transmission and collect visitor information. Managers of tourist accommodation or close contact services and anyone organising a wedding, civil partnership ceremony should still collect visitor information also. And anyone going to a funeral or a wake should still comply with guidance on funerals. Ideally, not be meeting in large groups indoors. And if required, COVID certification could still be used in hospitality and entertainment venues. And also the recommendation that people still wear a face covering in enclosed areas, indoors and hospitality, public transport, etc. Following this conclusion, Minister sought clarity on whether he could implement this policy and revoke the regulations without seeking a decision of the executive. In light of legal advice received, the Minister then sought the views of ministerial colleagues, and following this, it enabled him to make the decision that the regulations could be revoked, and here we are now. So these regulations revoke the Health Protection Coronavirus Restrictions Regulation 2021 and the Health Protection Coronavirus Wearing of Face Covering Regulations 2020. So we're at the position now where there is no more legal restrictions in place and everything, as I've stated, is in guidance. So I trust this has been helpful to members, and we're happy to take any questions that you may have.
Yeah, thank you, Niall. A couple of brief ones from me, and I see Jerry with a hand up as well. So briefly, a similar one to the one I put to Carol there is, can you confirm that it is essential, making and removing regs like this, it is essential, and particularly in the making of them, it's essential to have the Coronavirus Act Extension of Powers order in place. That's the order under which these are done. And can you give us any indication as to, now Carol has already said that she believes the Minister is bringing forward, can you give any indication of time frame on that issue and then of a second one?
Yes, Chair, happy to inform the committee that the Minister has now decided to proceed with the order. So work is ongoing at present, we're hoping, and we think it should be debated in the Assembly the week commencing the 21st of March. That's the earliest date available to debate. It does leave us quite tight because the order at present expires on the 24th, but we're hoping for debate in the week of the 21st. And the Minister has just recently made that decision, so we're happy to let you know this morning.
Okay. And then I just want to check with the clerk. Do we have a date for the debate for this reg, clerk? Or do we? No. So could you indicate what date you're looking at bringing this regulation forward, Niall, as well, please?
The current one we're discussing today?
Yeah.
Yeah, so it's debated in the Assembly next Monday, I believe.
Okay. We haven't, I don't think, been advised of that date yet. So, okay, listen, I'm going to go to Jerry Carroll there. Jerry, Lanneray, leis de Cash 10, the hall.
Yeah, thanks, and thanks for the presentation. Just two quick questions. I suppose, obviously, nobody wants to wear a mask unless they have to, unless it's safe and they're protecting their neighbours and friends. So there's a bit of concern out there, particularly amongst people from the clinically extremely vulnerable community, that there's a moving too swiftly of some regulations being lifted and how it may impact on those people. So just a response to that, and also generally, has there been any piece of work done to say, okay, it's not a legal requirement to wear masks now, as I understand the presentation. It's guidance. Is there any modelling, expectation, prediction, or however you want to frame it, as the number of people wear masks currently that will cease to do so, approximately, cease to do so with this change in law? Obviously, it's already happened, but is there any modelling to that effect? Thanks.
Yeah, thanks, Jerry. On the first point, while the regulations have been removed and it's not a law anymore, the guidance that we have in place, we strongly encourage everyone to abide by it. Any information got out by the department and from other departments still recommends the use of face coverings in such areas. I was on a bus this morning and they're still recommended there. So we just strongly recommend people continue to engage with as many of these measures as possible, because we all know that the pandemic isn't over yet. We still have high case numbers every day, so all we can do is continue to strongly encourage people. In terms of modelling, none that I'm aware of. There had been a study previously that showed that if it was moved from regulation into guidance, that a number of people would still wear it. Anecdotally, I can see that some people are still wearing masks, not as many as were before, but I'm not aware of anything specifically. But if there is anything, I'll be sure to let you know, and I can look into that for you.
Yeah, thanks. No, thanks, Chair. I think it'd be useful to share it with the committee, because, I mean, there's still numbers of people wearing masks indoors, and on transport, and I obviously do the same, but I think there has been a drop off, and obviously you don't want the legislation to be there just for the sake of it, but if there is a marked decrease in people wearing masks when there's still circulation of the virus, then that would be quite concerning. But appreciate if you could get that information. Thanks.
Okay, thank you. Yeah, and I think that's a really good point, Jerry, because information has been, and I'm not saying that's necessarily the officials here today, but it's been very difficult to monitor what the impact of putting in regulations or removing them has been. And funny, I do see, and this is anecdotal, it's not scientific, it's anecdotal, but there appears to be an awful lot of people at this point in time reporting that they had managed to stay COVID-free throughout the whole pandemic, but have now caught it. And that just, to me, would possibly indicate the benefit of the the benefit that the regulations were playing. But it is a pity that we don't have a more measured or measurable approach to deciding if that is correct or not, because it could be useful. Hopefully not be needed, but if it were needed for this pandemic, it will be useful, or indeed as learning for future, airborne viruses or conditions, diseases. So I think we're still behind the curve a bit in terms of that, and that is unfortunate given we're 2 years in. But anyway, thank you for the information there. I don't see any other indications. I'll just check with the clerk before I let you go, but just clerk, any other indications there?
No, none from me, Chair.
Okay, so Niall and Siobhan, thank you very much for briefing the committee, for taking questions, and we can let you go, and we'll continue on with our consideration. So good luck, Al Moore, to the both of you for now. Slán Liv.
Thanks, Chair.
Thank you.
Okay, members, thank you for that. And now, members, we formally now consider the SR. This SR is subject to the confirmative resolution procedure, and the examiner's statutory rules has not raised any issues in her report. Do members have any further issues they wish to raise in connection with this statutory rule? No, thank you. Then can I ask members to agree formally that the Committee for Health has considered SR 2022/47, the health protection, coronavirus restrictions, wearing of face coverings, revocation regulations 2022, and recommends that it be approved by the Assembly. Are we agreed? Yep, agreed. Thank you, members. So that just leaves date, time and place of next meeting, members. Next meeting will be on Thursday, 10th of March at 9:30 a.m. in the Senate chamber. Cormac, members, and take care all for now. Bye.
Thanks, bye.